Hi guys, here is a short video on the basic anatomy structures. So it's like how the bone, muscle, tendon, skin, fascia, etc., how they are organized. Usually when we teach anatomy, we directly go into the details of individual bones and muscles. So we kind of overlook the basic anatomy. So I thought I'll make a small 3D model to explain those topics. So firstly, in the body, everywhere in the body, the outermost covering structure is the skin that you can see here. The skin covers the entire body. This particular model that you see is kind of a cross section of an maybe the upper limb, say the forearm. Okay, so you are seeing the bones in the middle, surrounded by muscles, connective tissue, and skin. With that example, we saw the skin. Right under the skin, what we see is the fat. In anatomy, we call that the superficial fascia, which is nothing but loose connective tissue filled with fat, this grayish structure. Deep to that is the deep fascia, the blue color structure. Okay. Now, what happens with the deep fascia? It is not just covering the limbs like a socks, it also sends some partitions inside. You can see this blue color septa or partitions going inside like walls. The function of these walls is to keep the deeper structures in place. According to that, they are named. So for example, this one is called an intermuscular septum. This is called an intermuscular septum because it's just forming partition between muscles. As you can see, it's nothing but the continuation of the deep fascia. The deep fascia also joins with the bone where it will continue with the periosteum because everything is connective tissue. Okay, it's even though we call by different names, everything is connective tissue. The aponeurosis will sometimes fuse with the ligament, it will fuse with the deep fascia, fuse with the periosteum. When we say that, because they all belong to the same type of tissue, they just merge with each other. And in some places, you can also see that the muscle fibers, for example this, will originate from deep fascia. Okay, muscles not only originate from the bone, sometimes they come from the deep fascia or from the intraosseous membrane. This is an intraosseous membrane because it connects two bones. This is what we see from outside to inside. Skin first, superficial fascia next, and then the deep fascia. When we cut open the deep fascia, we will see all the muscles. Okay. Deep to everything is the bone. What we see here is called the cortex or the cortical bone or the compact bone. And this is the bone marrow. The bone marrow, the region will be filled with spongy bone or cancellous bone plus red or yellow bone marrow depending on the age or the site of bone which we are talking about. Usually in adults, in the long bones like this, it will be yellow bone marrow which is more fat than hemopoietic tissue. Okay, what else can we see here? You can see a small opening through which the artery, vein and nerve are entering the bone. That is called the nutrient foramen of the bone. Okay, it's actually one single hole through which all the three structures are coming in, but here I have shown that as different structures. But remember that there is a small opening through which the neurovascular structures will enter the bone to go into the bone marrow. So starting with the nerve, the nerves can be either deep or superficial. They usually give a branch to the bone. Okay, that's why if you break the bone, then you are able to feel the pain. So which means there is innervation for all those structures. They also give branches to the muscles. you can see that this nerve, for example, is entering the muscle, or this is also a good example. Usually the muscular branches will enter the deep aspect of the muscle. Okay, so if you're dissecting and if you're looking for a nerve, it's usually on the deep aspect. Some branches of the nerves, as you can see here, they come outside to supply the skin. Okay, usually if it's a muscular branch, the nerve stays inside the muscle. Okay, it goes to the muscle, innervates the muscle and stops there. In some places, the nerve can directly go outside, or it can even go through a muscle. If you remember, for example, coracobrachialis, the musculocutaneous nerve goes through the muscle. Okay, so it can also happen. Eventually, that nerve will pierce the deep fascia, run in the superficial fascia to end in the skin. These nerves are called cutaneous nerves or sensory nerves. They are superficial and they are prone to injury even if there is a small cut. You can actually feel your superficial branch of the radial nerve at the base of your thumb, on the dorsum of the thumb. It's that superficial. So that is a sensory nerve or cutaneous nerve. But if the nerve goes only to the muscle, then it's called a muscular branch or the motor nerve to that particular branch. Coming to the artery is usually deep. As you can see here, they are not on the surface. There's one here, one here. So the arteries are deep. They will also give a branch to pretty much everything around them. So for example, to the bone or to the muscle, yeah, you can see a branch here. I can see a branch here, going to the muscle. So this is a muscular branch of the artery. The veins can be superficial, which means close to the surface, which is quite normal, or they can be deep. So veins can be everywhere. Whereas arteries, just to be safe, like to prevent any injury to the artery, arteries are usually deep. If you go into the upper limb or lower limb, say in the leg region, like below the knee or below the elbow, there will be one artery, usually accompanied by two veins. Okay, so it's not like your femoral artery has got only one vein, so that's called the femoral vein. But if you go to anterior tibial artery, it will have two veins with it. These are called the accompanying veins or the venae committantes of that artery. It's a funny long name, but what I mean is there are usually two veins surrounding one single artery in the deeper regions of the body. The veins under the deep fascia can join with the veins outside the deep fascia by small communicating veins. These are called perforating veins. Okay, so these perforating veins usually have valves which will take the blood from superficial veins to the deep veins. When these veins, the valves do not work, then we get some conditions like varicose veins, for example. Veins can also be very superficial. They can sit just in the superficial fascia and they can interconnect with each other with lots of venous plexuses. These are the veins that we usually see under our skin. If you see the dorsum of the hand, you can make out the green or bluish lines running there. Those are the veins and those are the superficial veins. Arteries, on the other hand, sometimes can join with each other through small communicating arteries. If you see such things, this is called an anastomosis. Anastomosis means connection between two arteries, and they form the so-called collateral circulation. Collateral circulation means if one artery is blocked for some reason, then blood from another artery can run through the anastomotic vessel and then go into the blocked artery. So it is like a protective mechanism. So most of the big arteries will have some form of interconnection. Those are called anastomosis. If you find some arteries which do not have any such connection, then those are called end arteries. If there is any blockage in the end artery, then it's very difficult to maintain a collateral circulation, and it can be sometimes fatal or very dangerous to that particular structure. Examples of end arteries include arteries in your kidney, heart, and brain. You can access this model in Sketchfab, so just follow the instructions under the video. If you want, you can use this. You can play around, you can click on the individual structures. I haven't labeled the model at this moment, but it's not very difficult. You can find the labels by yourself. Repeat again: skin, superficial fascia, deep fascia, intermuscular septum, muscles, bones, bone marrow. Red, blue, and yellow is for artery, vein, and nerve. But try to look for the muscular branches of the nerve or the cutaneous branches of the nerve. Arteries, again, they have individual branches. Deep veins, superficial veins, perforating veins, and anastomotic arteries. Thank you.